welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Pho, founder and editor of KevinMD. Today on the show, we have Jaime Lewis. She's an internal medicine and palliative care physician, and she wrote the KevinMD article, Recommending Yoga to Your Patients? Consider this first. Jaime, welcome to the show.
Hi, thanks for having me.
So we'll get into your article in a little bit, but first off, can you share your story and journey to where you are today?
Yes, absolutely. So I've been practicing palliative care at Rush University Medical Center for the past 8 years now. But for the last couple of years, I've been focusing on supportive oncology. So I see patients with cancer diagnoses and also sickle cell disease as well. So they fall into that hematologic category. If you're familiar with palliative care, you know that we focus on symptom management, whether symptoms related to a disease itself or treatment-related side effects. We also help to counsel on advanced care planning and support patients and families throughout the spectrum of a chronic illness. I actually came to yoga through my own personal experience, starting it as a self-care practice, my first year as an attending, and just to kind of help with getting thrown into the fire of attending life. So it really helped me to manage stress and combat compassion fatigue. Overall, it was working pretty well, but I still kind of hit a wall probably a few years ago. So I actually left medicine for a while, about 6 months, traveled the world. I call it my own little sabbatical. And during that time, I just really dove deep into my yoga practice, my meditation practice, and that actually inspired me to become certified as a yoga instructor. So when I returned back to my medical practice, news kind of spread that, oh, hey, you're a yoga teacher. We're trying to get some classes started. So since then, I've been teaching staff and also patients in our cancer center. And the holistic benefits of yoga have just really paired nicely with what I was already doing in palliative care.
You took that mini sabbatical, 6 months, where you discovered and became certified as a yoga instructor. So what were the reasons that you temporarily left medicine for those 6 months?
I don't know if I would say I was burned out, but I will certainly say that I was extremely compassion fatigued. And that's kind of another interest of mine, is just physician wellness, professional wellness in general. And I see a lot of these symptoms in not just palliative care providers, but a lot of other coworkers practicing in other fields these days. And so I will say I was compassion fatigued and just kind of lost, because I had been going straight through since, goodness, kindergarten. Like I never took a break. And we see that more commonly these days with medical students. Like they will take a year or two off between college and medical school, which I think is just beautiful. Back when I was in school, that was unheard of. So I had been going straight through. So I never really had that time to just pause and reflect on, what is my purpose in life? What is the impact I'm trying to have on my patients and on the community around me? And so I really took that time to just have those reflections without the busyness of emails and all those things. Like a week vacation was not going to lead me to those types of reflections. I really had to step away.
Now, I have a two-part question. So first off, explain what compassion fatigue means to you. And second, what are you doing differently now that prevents you from undergoing compassion fatigue again?
So compassion fatigue for me, I like to describe it more as a kind of a metaphor that I actually got from one of the attendings who trained me, and that you kind of start your week or your day with this basket full of apples. And there are these apples of compassion and empathy. And as you go through each patient, each family encounter, each encounter with another physician that maybe you're helping in a family meeting, you're kind of passing out these apples. And at the end of the day, or at the end of the week, you kind of look at your basket and your basket's empty. And so you're essentially like running on empty of trying to give compassion. You're still able to do your job without making mistakes or harming or patient care or anything like that. It's just that you're spent, you're tired, and it's that kind of tiredness that affects you physically, mentally, and emotionally. What I'm doing now So I will say I do experience less of that now. And I attribute that to kind of developing more of a niche in my own practice, being able to one, focus on a patient population that I was kind of being pulled towards. So seeing patients with cancer diagnoses, opportunity came up in my medical center where I was able to step into that role. And then being able to incorporate or begin to incorporate yoga therapy and yoga practices by leading classes in the cancer center. And also we're trying to hopefully develop a yoga therapy program and just really expand these other complementary services to patients in the cancer center.
So let's transition now into the KevinMD article that you wrote. It's titled Recommending Yoga to Your Patients. Consider this first. Yeah. Now, for those who didn't read the article, can you just walk my audience through it and share the story of why you decided to write it?
Yeah, so I am currently studying to become a yoga therapist. It's a pretty intensive program. It'll probably take me about 2.5 years to finish it because it really is its own field. Mm-hmm. And so being in that program or studying in this field actually prompted me to write this article because I actually get a lot of patients coming to me asking about these other types of ways, these non-medicine ways, we'll say, for them to help with their pain or to help with their sleep, to help with their mood. Like, patients want to know information on these things. Like, a lot of them will be motivated to actively participate in their own care and not just feel like they're taking pills all day when they're already on enough medications. So it kind of stemmed from patients wanting, asking me these questions. And then I usually would let them bring it up. Like if they're asking me about like, oh, do you know anything about yoga? Or do you know anything about acupuncture, Tai Chi, these kinds of things? And if they bring it up, I'll be like, yeah, I'm actually certified. What is it you would like to know? Is there anything I can recommend? And just being able to, it kind of would just come on informally of them asking me these questions. And then once our classes started in the cancer center, I realized there was a lot of education that needed to be developed, not just for patients, but also for healthcare staff in understanding how to safely recommend these kinds of movement-based practices to patients. Because not all of them are going to be the same. You go to one community class to another, they're all going to be different. And we have to be a little bit more mindful, obviously, of how we guide our patients to some of these classes so they don't get hurt, so they don't actually worsen their pain. And in this article, I described the difference between therapeutic yoga and what we refer to as contemporary yoga. So that's going to be the yoga you just go to, in the community or in a gym or fitness center, where the classes are geared more toward generally healthy people. And they're a lot more focused on the physical postures themselves. Whereas in therapeutic yoga, there's still an element of using the postures, but then there's a focus on the meditation aspects, the breathing exercises, and also the lifestyle changes. And I think that's like a huge part of it. So in yoga therapy, we are trying to encourage and motivate our patients to take an active part in their own care. So the article is describing the difference between those and just how yoga therapy is really becoming integrated within comprehensive pain management these days.
Now, what are some common conditions that could be treated with therapeutic yoga?
Yeah. And so most of the referrals to yoga therapy are going to be for pain-based complaints. So whether that's chronic back pain or other chronic musculoskeletal conditions, a lot of mood disorders. So that could be chronic depression, chronic anxiety. I would say a key part here is chronic illness. Yoga therapists really work with people who are going through that spectrum of illness, working through illnesses that may not necessarily have a cure, and working with them to be able to find that wellness, whatever that looks like for them. So it's very individualized, but helping them to move toward wellness in the midst of illness.
Now, I'm an internal medicine primary care physician myself, and if I see a patient who may be a candidate for yoga therapy, where would I find one for that particular patient?
Yeah, so the International Association of Yoga Therapy or yoga therapists is actually a great website to start with because they will actually list or have a database of certified yoga therapists in your area. And then you'd be able to refer patients to them. Some like major healthcare centers are starting to integrate yoga therapy within their outpatient-based practices, or even sometimes in the inpatient setting as well. But the IAYT.org, that website is a great place to start with, because then you know that the practitioners are certified, they've gone through the appropriate accreditation.
Now, if I wanted to send a patient to yoga therapy for musculoskeletal pain, can you contrast the treatment course with something like physical therapy?
While both, I would say, are fairly individualized, I think that with physical therapy, there are going to be more standard protocols as opposed to yoga therapy. And there's pros and cons with that, I'll say. The problem with not necessarily having standardized protocols is that it's hard to replicate potential benefits in research, which is why yoga therapy is not fully covered, honestly, through insurance companies, because we need that replication in the studies to show that, yes, this is consistently helping. So physical therapy is going to be a lot more standardized, whereas yoga therapy is really going to be more individualized. So what is this person working with right now? What stage of their illness are they in? What are their goals of wellness? What is their current function like? And what are we trying to achieve? Everyone's going to be very different. And so yoga therapists really work on individualized care plans. What's similar, though, between the two is that both therapists, physical and yoga therapists, are going to work with the healthcare teams. So they're not trying to do anything that would contradict what the medical providers are doing. They are collaborative. So I think that's a good similarity as well. The main difference is that it's going to be very individualized. So one person may only be working with one or two physical postures, and maybe they just need a lot more of that breathing exercise and meditative component. Whereas maybe another person really needs to just be working with the postures because maybe they're not quite yet ready for that meditative practice. Sometimes certain conditions, you kind of have to work people to get there. We see that with our patients with PTSD or addiction as well. You kind of have to gently lead these patients to be able to practice certain methods within yoga therapy. So everyone's very different, and yoga therapists keep that in mind.
We're talking to Jaime Lewis. She's an internal medicine and palliative care physician, and she wrote a KevinMD article recommending yoga to your patients. Consider this first. Jaime, are there any techniques from yoga that a primary care physician or a clinician listening to this podcast can incorporate into a typical office visit?
And so something that's quick and easy. So one, just if patients ask you about yoga, knowing the difference between contemporary yoga and therapeutic yoga is a great place to start. And if they're like, hey, is there anything that maybe you would recommend? Just starting with a simple breathing practice could be great. Because maybe with some of the physical postures, again, everyone's going to be different. There are some that need to be adapted for patients to be able to do based on their physical function. But breathing practices are always a great place to start. This is something we do in our clinic visits with patients. The social workers that will partner with me in practice, they will teach some of these techniques to patients as well. Or I think a common place is when people are getting chemotherapy and they're in infusion and maybe they're getting a little anxious from their infusion. We work with a breathing practice, and one could be a simple diaphragmatic or belly breathing practice. And I think a lot of us doctors are probably familiar with that and even familiar with the benefits of diaphragmatic breathing to help with anxiety. And as anxiety calms, the body relaxes as well. So even just simply teaching diaphragmatic breathing and getting people to learn how to breathe through their belly a little bit more to help calm anxiety and relax the body. So a breathing technique would be a great place to start.
And for patients who want to see whether yoga therapy is right for them, or for clinicians who may want to consider prescribing yoga therapy, what are some online resources that you could recommend? I think you had mentioned a website previously.
Yes, I think the IAYT.org website is a great place to start as well. And even Mayo Clinic's main website also, they've already started incorporating yoga therapy into their health system. They have good information there as well. But I would say IAYT is a great place to start because they have information for patients and healthcare providers.
And my final question, what's your take-home message that you want to leave with the Kevin MD audience?
Similar to palliative care, I think therapeutic yoga has a wonderful approach on helping patients be able to focus on living well in the midst of illness. So just keeping in mind that when you're recommending certain movement-based practices to help with whatever chronic condition a person is experiencing, just knowing that therapeutic yoga may benefit our patients better than standard contemporary yoga in the community.
Jaime, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thank you so much, Kevin.